Hello guys, welcome to my YouTube channel, and today we will discuss about the topic health insurance, the lorry and RIT and GT. Please subscribe my YouTube channel, press the bell icon to get more informative video contents. Praise for lorry and record introduction. Preparation is key. What are your options? How can I cover? All insurance plan cover basic servers. And now the technology, what is the state of my health, private health insurance, the ACA, the switching jobs, construction, and also maybe lorry and record about the third. Price for the lorry and right. When you I need health care advice and I can understand and follow, I call Lori and she knows as stuff my Danny walked and JD Lori and is my go-to expert on healthcare law. She makes in the understandable and easy to follow for our doctor and their patent tool. Michael Nichols and the physical aliens. Lori and now the healthcare system inside and out. Whenever have question about healthcare, Lori and has the answer and make girls lower and St. Johann Backup Hospital. And whenever my family has a health call issue, Lori and is my first call for the best advice. Donna Korean and getting coverage for the prescription and drugs can be a big problem for patient. Lori and now the insider and secret to making it easy and Korean behavior. Lori and I has also live the difficult issue the families confront on the daily basis. As they struggle and with the drilling and maze of the hospital and multiple and specialists and the insurance companies as our family tireless and advocate for our father and now mother wisely and ever for the hair cuffs and with more patience and then Lori and locked out of our bed and Stephen Rigard and JD MPA. Introduction. Every year many people throughout the United States choose an health plan. Healthcare is expensive. The average cost of the having a baby or staying in the hospital for 3 days is $3,000, $30,000 in order to manage the cost and most people get health insurance and since the Affordable Care Act passed health insurance is required without and it you will likely pay a penalty and therefore it is important and to understand your option and select the best health plan and for you and your family. Most employers have an enrollment and period available ever and year. Employees maybe have a choice of several plans and depending on what is offered and by their employer. Those how quality for medical also have an enrollment and period at the end of the each year. The AC also is its annual enrollment and period starting in November. Choosing a health plan for yourself and your family can be daunting and with the several options and available many people just look at price and some people simply keep the keep the health and play they have because it is too hard and to finger and to out to show to switch and their guide is the main to help you examine and your choice and move forward. Keep in mind and that health care and can change over time as of the this printing charge and to the foldable and care act have been being a discussion topic in government and research through government website or visit www my husband and can be find of the current information. Precipitation preparation is key before you are select. Please subscribe my YouTube channel, press the bell icon to get more informative videos. Before you are select a plan, gather and your important information. You need information of two parts of the process, relevant detail for picking your plan and detail to enroll and do you have contact doctor you see and consider your family doctor or primary car physical and any specialist and your family visiting OBGYN and allergist and ophthalmologist and interest it is your children medication. Make a list of all your doctor and the hospital where they work, and not all doctor work at every hospital. What is in this information important, and not all insurance plans include every doctor and hospital. You should start by listing and your most important doctor and see whether the health plan and you are considered include those doctor and hospital. People are often disappointed by other insurance plan and they selected when you are discover they cannot be keep their doctor and with their health plan. Avoid this problem by comparing your list of doctor and with the plan. Most health plan have a website and where you can search for in network physical and see action and five now of the technology. For more about in network was out of the network physicals. Next, list of the all medication and the other healthcare need. If you rely on some very specific medication, you need to know and whether your health and plan cover that medication. Many insurance and plans encourage and you to use generic brand drugs, and the insurance plan may cover a similar drug but not extract drug, and you are taking and should to talk and to your doctor our pharmacist to determine whether is the acceptable for you and you take a generic or alternative prescription and drug. If you not and you I will want to look for a plan that will cover the medication with doing this background preparation, and you might find that you will have a lot of the out of the pocket and costs that are not covered under your insurance and plan. See section 5 note the technology and for about out of the pocket cost by doing your home on work, and you might be able to avoid this cost. Where are to begin, and when you are ready and to enroll in the health insurance, and you will need some basic information about you and your family including birth dates and age and social security members, and create a medical life list in order to keep all of this information. Organization I recommend creating a medical list life list. A medical life list is a personal medical record that is the created and updated by you, and you might think and that is the unnecessary because your doctor office and has your medical record, and however you are the only person and how has the whole picture. And when you are searching for the insurance access your healthcare and need, having a list of all your doctor and test and medication will be your best guide, and when you are deciding which insurance plan is the best for you and your family. Hint and get me free and what you need first ebook and to find out how to set up your own medical life list, and visit www.myhealthspin.com. The medical life is list should include your personal information such as name, address, social security and number, driver's license number, employer and insurance provider, clothing, and your group number as you change increase plan, and be sure to keep a list of all your prior insurance and number in the case you have to refer to it later, and you may receive a bill from a period doctor and visit test or producer and so on. You to have provision insurance information accessible just in case. And next, the list should detail all of your healthcare provider information such as their name, addresses, specialty and hospital affiliation, and also include my information about major health events and including the hospitalization and the charge in insurance. The list should details and medication being taken and allergies, and you have family members have or our children keep track of the illness and vaccination and day of the miss school. In addition to the information about keep copies of the important medical record, test and laboratory results. These are many some handy and as you are visit wish and with your doctor and or specialist, and keep your list updated. Remember to update your list when you are your loved ones at or on change a doctor or medication, as well as the date of far when the change happen, and always keep the list in a secure format and share by all copies. If you are comfortable and with computer and can keep a digitally and encrypted copy of the list and keep only an electronic copy. However, if you prefer and to keep a paper and copy, do so. And finally, and your loved one should know and where the list is and have access to if they need to assist and with your healthcare. And one your list and it prepare, you will be have everything and you need to start to look for insurance coverage. The bottom line, start with your family names and social security members numbers. Prepare a complete list of the doctor before you start and prepare a complete list of the medication. Have your medical life list handy and update your list with the with and change with any change. What are your options and before you can choose a health plan, and you need to know and that your options are the first place to start is to ask and whether your employer provides insurance under the AC and employees how work and more than 30 hours weeks and must be offered insurance unless and the employer has less than 50 employees. And if the employer does not provide insurance, it must pay a penalty. And therefore is if your employer offer insurance, and this is the where you and should look for health insurance. Insurance for work, if you are determined and that you can get insurance for and work, and you should ask your employer. But the health and plan official and some large employers offer several different and health insurance companies. Some employers only offer and one health insurance company and but different choice in the type of the policy. For small employers, and they may offer not insurance only on one option, and ask your employer for the health insurance information. You can determine and which is one is the best for your insurance and your family. If the several different choice, and you will want to use their medical life and list to determine and which insurance plan is best for you and your family. Check and see if your doctor participate and your employer health plan. Do not simply ask whether and your doctor accept your insurance. If please subscribe my YouTube channel, press the bell icon to get more informative videos. Thank you. Your doctor merely and accept your insurance but does not participate in the insurance, and you may have to pay and for money of the cost out of your own and pocket. If your doctor participate in the insurance, and that means that the doctor and has already agreed to accept the prices the insurance company has negotiated. And for example, an office visit may cost $100 and the insurance company might have agreed to pay $60 as for payment for an office visit to is participating healthcare provider. And if the doctor participate in the health insurance plan, that means that they will accept $6 and as full payment for the service. The doctor will write off the remaining $40. If however the doctor merely and accept the health insurance but does not participate, and the doctor will bill the health insurance plan for $100, the healthcare insurance will pay $60 and you have may be responsible for paying the remaining $40. And in this case, and you can decide whether and you want to keep and your current doctor and pay the difference, or choose a new doctor to how participate in the health plan. And knowing this sample question to ask, they can save you hundreds of the dollar insurance through your spouse work. And most companies and require the employer to pay some portion of the monthly healthcare premium depending upon the cost. And you might want to determine whether your spouse and can add you their employer health insurance plan, and your spouse and maybe better or less expensive insurance additional. Maybe large employer want to encourage and you to use and suppose insurance. As a result, your employee might you get a cash and payment every month or at the end of the year for the using and your spouse and insurance whether and your should and choose your spouse insurance or your employer insurance depend on the what types of the insurance and your spouse has, and whether it is the cost effective and for your and to use your spouse insurance. You also must and check to see whether and your doctor participate in your spouse insurance and plan. Look at the both your health plan opinion option and other spouse and compare the coverage and the cost participating physicians and make a choice. Medicare is a government insurance and program that is the accepted and by almost all healthcare provider. If you are age 65 year or old, you are qualified for the medical if you are quality, and you may choose Medicare as your primary healthcare insurance. Here is the what you need and to know about is the medical if you are quality, and you can get is the either and from the federal government as a private insurance company. Medicare Part A and B medical insurance program run by the federal government. And alternative you can choose Medicare Part C, which is the called Medicare Advantage, and Part C will be provided by a private insurance company. And the federal government funds Medicare through tax if you choose it. And traditional Medicare Parts A and B, you will pay part of the cost and through monthly premiums and copies. Another important consider and is the most private insurance company. The federal government funds and Medicare through tax if you choose traditional Medicare and Part A and B, and you will be pay the part of the cost through monthly premiums and copies. Another important consideration is the Medicare does not cover participation and drug cost under Parts A and B. However, by choosing Part A and B, and you are eligible and for the Medicare Part B prescription and drug coverage, a private company will provide the Medicare Part D prescription and drug coverage. And Medicare Advantage plan include prescription and drug coverage there. Thus if you have a medical advantage and plan and you are not eligible for Part B, and Medicare Parts A and B coverage is the same throughout and the country. However, your choice and will vary from the state to state. Of medical advantage Part C and prescription and drug plans Part D. Medicare supplement insurance. Many people purchase medical supplement insurance called Medicare. Please subscribe my YouTube channel, press the bell icon to get more informative videos. Thank you.